Okay, so today we're going to talk about the respiratory complaints of Arsenicum iodum. So first we're going to talk about the clinical, that is where it shows its action. It shows on the affections of the lungs, pneumonia, tuberculosis, early stage of the tuberculosis, bronchitis and hydrothorax. Right now we come up to three things, that is the coryza, the cough and the throat. Right, starting with the coryza, what we see in coryza is that the discharges are very acrid. Acrid meaning it is burning and profuse. A lot of coryza will come out, discharge will come out. It is thick and gluey. As you can see, it is gluey, yellow, honey like. Right, it is acrid, profuse, thick, gluey, yellow, honey like, and causes burning of the part on which they flow because they're acrid. Also, all right, so that is why they're also called as corrosive discharges. These discharges, we see that in consistency they are very thin in acute cases and thick in chronic cases. So this was all about the coryza. Also, there is one more thing that comes up in coryza, is that there is tingling in nose with constant desire to sneeze. There is this tingling and there is this feeling, constant desire like to sneeze. Along with coryza and cough, we see that this remedy has action on throat as well. So in throat, it can produce diphtheria, tonsillitis, because it acts on glands, enlargement, it causes enlargement of gland. Then it also acts upon chronic follicular pharyngitis. The pharynx becomes very dry and there is burning in pharynx. Alright. Also, there is the throat becomes enlarged because it has action on glands which cause its enlargement, the fetid breath that we see, and there is difficulty in swallowing, that is dysphagia. All right, this is all about the remedy arsenicum iodum. First we talked about the clinicals, that where are we going to use it. Then we talked about the coryza, which is acrid, yellow, pus like, gluey, thick and profuse. Then we came up to cough, which was dry cough but with expectoration, which was green, mucopurulent, stringy, pus like. Then we talked about pneumonia, which is if it is not cured by any other remedy, we can use this remedy. Then we talked about throat, that it acts on diphtheria, tonsillitis and pharyngitis and causes all the symptoms that we have discussed. So this was all about arsenicum iodum, the respiratory complaints.